Introduction. Discrimination in healthcare based on gender and race remains a significant issue in the United States and globally. These disparities can affect the quality of care patients receive, their health outcomes, and their trust in the medical system. Understanding how bias, both implicit and explicit, impacts healthcare is essential for improving equity and patient outcomes. What is healthcare discrimination? Healthcare discrimination occurs when patients receive different treatment or access to services based on characteristics such as race, gender, ethnicity, or socioeconomic status. This can be intentional or unintentional, and often stems from systematic inequalities and implicit bias. Gender discrimination in healthcare. Women's symptoms are more likely to be dismissed or misdiagnosed compared to men. Studies show women wait longer in emergency rooms for pain treatment than men. Heart disease in women is often underdiagnosed because symptoms may differ from the typical male presentation. Women's pain is more likely to be underestimated and undertreated. Race discrimination in healthcare. Black patients in the U.S. are less likely to receive adequate pain management compared to white patients. Maternal mortality rates are significantly higher among Black women than white women in the United States. Minority patients often have less access to high-quality healthcare facilities and preventative care. Language barriers and cultural differences can negatively impact care for Hispanic and immigrant populations. Global perspective on gender and race discrimination. Discrimination in healthcare is a global issue affecting many countries beyond the United States. The United Kingdom. Studies show ethnic minority patients report poorer healthcare experiences compared to white patients. Black women in the UK are significantly more likely to die during childbirth than white women. Canada. Indigenous populations experience lower life expectancy and reduced access to healthcare services. Reports indicate Indigenous patients sometimes face stereotyping and discrimination in medical settings. Australia. Aboriginal and Torres Strait Islander people have higher rates of chronic illness and lower access to healthcare. Systematic barriers contribute to reduced quality of care and poorer health outcomes. Developing countries. Women in some regions have limited access to healthcare due to cultural norms and economic barriers. Racial and ethnic minorities often face discrimination in access to basic medical services. Maternal mortality rates are significantly higher in low-income countries, especially among marginalized groups. Implicit bias in healthcare providers. Implicit bias refers to unconscious attitudes or stereotypes that affect understanding and decisions. Healthcare providers may unknowingly assume pain tolerance differs by race, spend less time with certain patients, or offer fewer treatment options to minority groups. Consequences of discrimination. Poor health outcomes, increased mortality rates, reduced trust in healthcare systems, delayed or avoided medical care. Steps towards reducing discrimination. Cultural competency training for healthcare employees, increasing diversity in the healthcare workforce, standardized medical treatment protocols, patient advocacy and education. Conclusion. Gender and race discrimination in healthcare is a critical issue that requires awareness and action. By recognizing biases and implementing systematic changes, healthcare systems can move toward more equitable care for all patients. For my sources, I use the Centers for Disease Control and Prevention, National Institutes of Health, American Medical Association, World Health Organization, and the Institute of Medicine.